Hello, everyone. Welcome to Healthcare Excellence Canada's webinar series on enabling aging in place. I'm Andrea Piché. My pronouns are she and her, and I am pleased to be your host today. The Enabling Aging in Place webinar series aims to explore a wide range of topics and share success stories and lessons learned for initiatives that support older adults in aging at home with the right supports. Each webinar will feature different topics. Organizations and subject matter experts will all share their experiences. We know that the community of people supporting aging in place across the country is broad and that folks are keen to learn about what others are doing, and we hope to help facilitate that learning through this webinar series. The topic of our webinar today is family caregivers as valued partners to support aging in place. In this session, participants will hear about evidence related to the critical role of family caregivers, as well as about how to best support family caregivers based on your unique roles in the health and social system. We are pleased to offer French simultaneous interpretation by Boost Events, a subsidiary of Boost Lingo. If you wish to hear the voice of the interpreter, please select French from the interpretation menu at the bottom of your screen. If you need any support during any time at this webinar, you can reach out to tech support using the chat feature. We invite you to share your questions and comments at any point using the chat box in either English or French, and we encourage all of you to respond to comments and answer questions in the chat as you wish. We'll aim to connect as many of your questions as we can with our speakers during the Q&A session at the end of the webinar, but we recognize that we may not have enough time to answer every question. So in our follow-up email, we'll include answers to questions we might not have had a chance to get to. The session is being recorded, and a link to the recording will be available in the coming weeks for you to review or share with colleagues who missed it. Enabling aging in place is place-based work. Where we are matters. I'd like to start by acknowledging that we are meeting on land that has been inhabited by Indigenous peoples since the beginning. In particular, I'd like to acknowledge that I'm joining you from Grimsby, Ontario, which is the traditional territory of the Anishinaabe, Haudenosaunee, and Ojibwe-Chippewa people covered by the Upper Canada Treaties. In support of my personal journey of truth and reconciliation, I was recently gifted the late Murray Sinclair's memoir titled Who We Are. This book is a beautiful tapestry of stories that weaves together some of his life lessons as a guide for how to reconcile and move into a future that is based on truth and mutual respect. And what I appreciated so much about the way his stories illustrated the power of grace and humility. And so if you're looking for inspiration on your personal journey of truth and reconciliation, perhaps this book might resonate with you as well. Before I introduce our speakers, if you haven't already, I'd like to invite you to say hello and share the name of the ancestral lands that you're joining from today. And so with that, I am pleased to welcome representatives from Caregiver-Centered Care Initiative, which is based at the University of Alberta's Department of Family Medicine. Today we have Dr. Jasneet Parmar, Glenda Tarnowski, and Alison McKelvey-Jozsa. Welcome. Nice to see you all. Hi, if you want to unmute, come on in the room. And I'd love to turn it over to you for your presentation.
Great. Thank you, Andrea. Welcome and thank you for the invitation to present today on family caregivers as valued partners to support aging in place. We are pleased to be with you and partner with Healthcare Excellence Canada for this presentation. Next slide, please. We acknowledge that we're joining you today from Treaty 6 and 7 territories. We respect the histories, languages, and cultures of First Nations, Métis, Inuit, and all First Peoples of Canada, whose presence continues to enrich our lives. We are grateful to share these lands and are committed to forging culturally safe relationships. May we learn together, engage with diverse stories and knowledge, and use our individual and collective lives to contribute to reconciliation. Indigenous peoples celebrate the value of family caregivers as an enriching experience for caregivers' lives, care recipients, and the community as a whole. It is in this spirit that we present to you today. Next slide. The Caregiver-Centered Care Initiative is a program of applied research and innovation at the University of Alberta Department of Family Medicine, led by Dr. Jasneet Parmar. Dr. Parmar is a care of the elderly physician and has worked for the specialized Geriatrics program in Edmonton since 1992. She's also a professor in the Department of Family Medicine. We are pleased to have Alison McKelvey-Jozsa from Alberta Health Services Specialized Geriatrics Program joining us today to co-present. As a professional social worker with over 30 years experience, Alison is a passionate supporter of family caregivers through her work with older adults. We look forward to having Alison share about the pilot project she and her team have undertaken to support family caregivers as partners in care. I've been part of the co-design team for caregiver-centered care education since it began in 2014, and in 2022, I joined the core team. My background is in healthcare and social innovation, with a lengthy career in nursing, health profession regulation, and leadership. Like my colleagues, I'm passionate about health system transformation. Next slide. Today, we're going to share about the pivotal role of family caregivers, their significant contributions, and the consequences of caregiving. The role and importance of health, social, and community collaboration to build a better system of support for family caregivers, and the benefits of caregiver-centered care education for the healthcare workforce to improve outcomes for patients, caregivers, providers, and the healthcare system overall. We welcome you to put your questions in the chat, as Andrea mentioned, and we'll respond to as many as we can during the Q&A at the end of the webinar. Please join me now in welcoming Dr. Jasneet Parmar.
Thank you, Glenda. So let's begin with asking ourselves and reminding ourselves, when we talk about family caregivers, who are they? And we may use other terms, such as carer, care partner, sometimes even informal caregivers, though there is nothing informal about what family caregivers do. We are speaking of those people. They can be a family, friend, neighbor, or chosen family who have now taken on a caring role that provides emotional, physical, practical, and even financial support to people who have either mental illnesses, physical illnesses, disabilities, or age-related needs. So we are not talking about just members of a family. We are talking about those members who have actually taken on responsibilities to care for someone who now has disability or diseases or age-related needs. Next slide. And they are now the largest care workforce. In Alberta itself, we have 10 times more family caregivers than we have healthcare providers. There's 1 in 4 now across the country provide family caregiving. This is, without a doubt, the largest care workforce now in our society and in the healthcare system. And why is that? Because they are the ones providing anywhere from 75 to 90% of care for people living in the community. It could be in their homes, it could be in lodges, assisted living, and they provide anywhere from 15 to 35% of care in congregate facilities that are publicly funded, such as designated supportive living and long-term care. You can see the billions of unpaid hours that are provided across Canada by our family caregivers, equivalent to 2.8 million FTE, billions and billions of dollars of unpaid care work. And we have to remind ourselves, in the healthcare system and in society, these caregivers play a critical role in reducing safety incidents, improving our care recipients' quality of life and quality of care. Next slide. So, why is it that family caregivers are, and it's just a thought that I'd like you all to reflect on. Why is it that family caregivers are seen as the largest workforce? It is because they have taken on an array of activities. Their contributions are enormous. The kind of things we take for granted and provide episodically when they come under our care, they are providing. It could be 24/7. It could be large parts of their day. It could be overnight. And what does that look like? Well, it could be basic care, dressing, washing, grooming, bathing, toileting, transfers, ambulation. It could be instrumental care. This is where they help with shopping, providing transportation, getting medications, managing money, housekeeping, preparing meals. They do a lot of medical work. They are the ones procuring medications, getting them changed when needed, getting them blister packed, administering the medications, monitoring the side effects of medications. They are the ones who organize the medical appointments. They're the ones who come to the medical appointments and give us input as to how somebody is doing. They are the ones by the bedside, in acute care, in emergency room, in rehabilitative care, who are giving us input into our care planning and giving us information about that person's identity, their strengths, their limitations. They are the ones on call. They are the ones monitoring crisis, alerting us when needed. And sometimes that call is 24/7. They carry a lot of emotional and physical burden. So they are the ones who are providing socialization, emotional support, physical burden, lifting, carrying, bending, financial support. Tremendous amount of money is being spent out of pocket by family caregivers to support care recipients. And the structural burden of care. We think of ourselves as the most responsible practitioner, as the care coordinator, as the case manager, but truly they are the captains of the team. And they often set aside their own needs. Next slide. We'd like you to hear from a double duty caregiver about the kind of responsibilities that she had to take on. If you could play the video, please.
Our caregiving journey started in 2011 with the onset of a very difficult medical situation with my partner, my husband, and an unexpected journey ahead for the next many, many years. My background has been physiotherapy. My original training was physiotherapy, so certainly familiar with medical background. And then over the past 25 years leading up to his illness, I worked with Stars Air Ambulance. So very familiar with the challenges of an illness or medical situation, but certainly did not anticipate what we would be going through with a life-threatening illness in our family. I also have been involved in caring for an elderly family member as well, with another family member. And certainly that caregiving situation and dynamic brings on different challenges with different circumstances. The positives of caregiving are enormous. You become closer to your loved one in many ways, in ways that you never expected. It's a helping and caring situation. It provides an opportunity to give an example to the younger generation on the challenges that they'll have in the future and set that example. It breeds resourcefulness. Certainly my background and that of other family members helped us pull in those resources. But the resources aren't always there. And sometimes you find yourself very alone. So from a positive perspective, that forces each of us to ask for help, which is very hard to do. I think a lot of us just want to cope on our own. We can manage this. I can handle this. And that's not always the case. Caregivers need to learn to say no. I know I tried to take it on myself and say, I'll handle this. And it's physically impossible to do that. It's isolating. Caregiver caregiving is isolating, especially as illness proceeds. And we certainly had the situation where at one point I wasn't really able to leave the house unless I had relief. And that's very difficult. Once family members have exhausted their vacation and their days off and can't lean on friends forever, they have their own lives. How do you find resources? So caregiving tightens your circle. Caregiving puts you in the situation of coming face to face with the fear of loss. And that was certainly our case, is trying to do everything possible to ensure that the best care possible and the best solutions were available. And that was the backdrop to all of this, is trying to make sure that survival was the end result. The other negative is financial. We found ourselves very quickly in a situation where we needed to retire, which was the plan in any event, but certainly expedited. And that puts a different dimension when you're doing your last sort of 5 years of work and realize that it's not going to be there.
Next slide. So it is for good reason that our family caregivers are getting more anxious, stressed, and burnt out. Over the decades, and once you see the slide, you will see there's been an exponential increase, particularly in the last decade. And here are various reports that show the increase in rising family caregiver consequences of caregiving. These consequences can be in the way of mental illnesses, depression, anxiety, and even suicidality. It can be deterioration of their physical health and extreme financial burden, as well as loss of employment. So there are some considerable and significant changes that can occur in family caregivers' caregiving trajectory that we have to be mindful of as we engage them in care. As we continue to ask family caregivers to do more, because we have fewer family caregivers, we have changing family structures, we have longer care trajectories. People want to live as much as possible, stay at home and live their lives out at home. Aging in place, yes, absolutely needs to be honored. However, it does take the family caregivers' involvement to make that happen, especially in context of longer life trajectories with chronic progressive illnesses and disabilities, as well as mental illnesses, end-of-life care. The reason I highlight these is because it is the load and length of caregiving that causes this caregiver stress and burden to increase exponentially and literally bring the caregivers to the brink of unable to care. So we got to keep that in mind when we think of family caregivers who do not want to care anymore, who cannot care anymore, who are not in a position to care anymore, because we have over time perhaps overutilized them and undersupported them. Next slide. This is true of our double duty caregivers as well. So this is results from a survey we did, and this was across Canada. These are healthcare providers who are caregiving, and close to this, and this statistics comes from Care and Work, close to 60% of people who are working are also caregiving. And this is true in a healthcare system as well. And you can see from this survey, healthcare providers who are family caregivers, 65% of them in this survey reported they were living on the edge. The expectations on them were high, supports were weak, boundaries were blurred, and the caregiving interface was large. So keeping all this in mind, the contributions of provided by the family caregivers as well as their challenges, we're going to give you some hope. So I'm going to turn it over to Alison, who will speak about some pioneering work being done in her program.
Hello. Thank you so much, Glenda and Dr. Parmar, for having me here today to present to such a prestigious audience. It's a real honor, and I'm grateful to share the work that we've been doing at Seniors Health in Calgary, Alberta. I'm just a spokesperson for our very hardworking and talented team. I've been practicing social work for over 30 years and joined this team around 7 years ago. I feel that given I'm a bit newer to the healthcare system in the trajectory of my career, I come with somewhat fresh eyes, which is a benefit when trying things that are new. My fellow teammates are all just as experienced with decades of work, to the point of one of our geriatricians. He calls us the geriatric social workers, which I'm not sure is so complimentary. Today, I've been asked to share with you how we integrated caregiver-centered care into our work on a daily basis. And we're continuing to evolve, grow, and learn from caregivers and patients so that we can do better to intentionally practice family, caregiver, and patient-centered care. As a result of these changes, we've seen shifts in how we feel about our job. Not just our social work team, but our admin, our RNs, geriatricians, and the rest of the multidisciplinary team. The best part of the pilot that I'm going to be sharing with you today is that we really know we're doing better, and it makes us feel better. Before I dive in, however, I wanted to share a quick personal story about caregiver-centered care and practice. Remember what Dr. Parmar said, 1 in 4 of us are caregivers. If you aren't a caregiver, you're probably going to be a caregiver or you're going to need one. This story is about my folks. Well, my mom got sick in October, so I had some firsthand experience as a caregiver. And I can tell you that it's a lot easier supporting caregivers than it is being one. The story, however, isn't about me or my folks directly. It's about my dad's doctor. It became very apparent when my mom got ill that my dad had actually been doing a great deal of caregiving over an extended period of time. He's 91, really stoic, a civil engineer / farmer, just to give you a bit of a picture. The short story is that my mom needed a new doctor who was connected to the hospital as we anticipate more hospitalizations, and my dad decided to ask his doctor. Well, he went to see him rather than call. I'm pretty old school. And when he came home from the appointment, I met him in the driveway to avoid some stress on my mom. He said that his doctor asked him how he was. He said, with tears in his eyes, that my dad just talked for 10 minutes to the point that the doctor offered him a Kleenex. My dad was blown away that he needed that, just to talk, be heard, feel confident that he was now part of a very supportive healthcare team. He can now support my mom at home better, feeling assured that he has somebody in his corner when he needs it. And this is just a small personal example of caregiver-centered care in practice. Next slide, please. So, who are we? I work for Specialized Geriatric Services, which is under a huge portfolio, the Seniors Palliative Continuing Care portfolio. It's a big team. I included this slide. My colleague said that it looks like a mess, but I wanted to keep it so that you could have an understanding of the vast scope of our practice. As social workers, we support Seniors Health, which is a specialty consult clinic offering a multidisciplinary team approach. The multidisciplinary team supports geriatricians who assess and treat complex medical needs of older adults. Aside from a number of issues that our very skilled and talented geriatricians deal with, we deal a lot with dementia and dementia diagnosis. We also, as part of our social work team, work to support the Calgary Falls Prevention Team, as well as the Alberta Health Family Caregiver Centre. I just wanted to point out that the social work team is made up of 4 part-time social workers, 3 of which started about 3 years ago. As I mentioned, we come with a great deal of experience, but when we started, we were struggling to know how to support caregivers, both in our role with Seniors Health, the Calgary Falls Prevention Team, as well as the Family Caregiver Centre. We were asked to manage the Family Caregiver Centre after a previous social worker had left. And we got a number of calls where we weren't sure how to support. We were aware that there was a number of supports out there in the community, but that there were also gaps. But we didn't know if the caregiver needed an education group, a support group, counseling, respite, or basic needs. The community resources confused us. So we could only imagine how that left the caregiver feeling. Well, we got permission from our fabulous and progressive management to do an environmental scan of the resources available and try and identify the gaps and overlaps. We had this fantastic idea to do an algorithm that if this type of caregiver called, they could be referred here or there. And we thought, even after we developed it, if we blew it up and stuck it on our wall, admittedly, it was very confusing, but that it'd help us help them. And amongst the scan of supports and services, that's when we came across the Caregiver Needs Assessment Tool. And that's how we found Dr. Parmar and the Caregiver-Centered care team, which we were very grateful. So we asked for training, and our manager set up a 1-hour meeting with Dr. Parmar and her co-worker, Sharon Anderson, who are both fantastic. And they provided us training and looped us into their co-design team for the training that they're presenting. We fell in love with the Caregiver Needs Assessment Tool. It was perfect, a perfect fit for client and caregiver engagement. It quickly allowed us to assess the needs of caregivers who we were meeting with at the time, so we could direct them to the right supports or support them ourselves and take the guess out of it. It was exactly what we needed to support patients and caregivers following a new dementia diagnosis as well. Very useful in our role with Seniors Health, as well as the Family Caregiver Centre. We felt we had a tool that worked. In the meantime, we were still getting calls from worried caregivers from all over. In a 4-month period, we received over 90 calls. One I remember particularly was a desperate caregiver feeling all alone. She was calling from a very busy hospital in the elevator, where she found our number for the Family Caregiver Centre. She said that her husband was in the middle of heart surgery. She also had a daughter at home who had a severe disability. She didn't know what she could do, and she just needed to talk. We thought, what? There's no one at the hospital to ask you or support you? You had to call a stranger from an elevator? Admittedly, my manager said that it was a real benefit that we actually had posters in the hospital elevators. And she's right. But still, no one saw her or offered her any assistance. I could only imagine the staff would be looking to her at come time to discharge her husband. So those 90 calls, we assisted the caregivers either over the phone or in person, but we knew more needed to be done. I recall tracking the caregiver calls on an Excel sheet because our system wasn't set up for documenting communication with caregivers yet. And I remember my manager asking me once, wow, Alison, why are your numbers so down with Seniors Health? And my cute friend Michelle said, she takes all the caregiver calls. Well, we now have a very good system for tracking all those calls in our healthcare system, in our Connect Care, under emerging new clients. Next slide, please. Following our training on caregiver-centered care, our social work team was using the Caregiver Needs Assessment Tool but we wanted to test it out with our clients and seniors' health to see if we could prove that everyone, our whole team, could use it. We asked our geriatricians to refer patients with an identified caregiver, and we complete the caregiver needs assessment tool and offer support to those caregivers based on those results, track the results, and other qualitative data. Now, this is pretty high level. We are not researchers under any stretch, and this was a quality assurance pilot. Oh, we sold it to our managers, which was an easy sell. They're pretty proactive, and this pilot was actually part of our job. And it wasn't going to take just a little bit of extra time for us to track the results and compare the data. Just one of our very smart geriatricians, Dr. Dempsey, she agreed to help us and suggested we do a comparable group. Wonderful idea. So we pulled 30 other charts. Yes, we pulled them. We were paper at the time. And Sharon Anderson from the Caregiver-Centered Care Initiative provided us with an Excel sheet for information, tips and tricks that would be helpful for us to track. This was some of the information that we gathered in our first pilot. First of all, we found that the CESNAT was easy to use and no one complained. We had originally used a caregiver risk screen, which we found very helpful at times, but it could be cumbersome, especially for those caregivers feeling really, really guilty. If their risk was high, it made them feel more guilty. We also felt much better about how we were supporting caregivers and the patients in the circle of care. We'd get a referral where the doc had highlighted complex family needs, that the kids were arguing over diagnosis and legal documents. And I'd anticipate, oh boy, they're going to need help with legal and paperwork and lawyer support. Interesting, when they completed the CESNAT, we did it alongside with them. What they were really asking for is what to expect in the future. More information about the diagnosis. The assessment quickly identified the most important needs to them, so we could support them accordingly. And as you can see from the results of the CESNAT here, our results were in line with the research that Dr. Parmar and Sharon Anderson had found. We also discovered that the 30 comparable clients, the caregivers were often referred to as collateral information, which is fair, right? And they were referred to a bunch of community organizations as we were trying to support them the very best we can after a dementia diagnosis. But we weren't convinced that they were getting connected to those resources. We also noted that we never even considered that in our pilot, 28 of the 30 had completed all their advanced care planning documents, some with our help, as they ticked need help with legal, compared with our comparative group, where it was only 11 out of 30. Next slide, please. So overall, the Caregiver Needs Assessment Tool pilot was a success. We loved using it. Our patients and caregivers felt more supported. Our managers were happy because they had tangible results. But this project didn't take much extra time at all in our ongoing work. It was our ongoing work. It was timely. The entire session took 30 to 60 minutes. And when I say that, it takes 3 minutes to fill out that CESNAT, a Caregiver Needs Assessment Tool. We call it the CESNAT. But if you're going to work through it with the caregiver and their family, you're going to need a little bit more time to hear the story and to listen and to help develop a focused care plan instead of referring them to everywhere. Much more helpful than our algorithm. And some people said they didn't need any referrals, that this session with us with the assessment tool was really all they needed, was all the information they required to know what to expect in the future. It was a holistic approach that included caregivers and their patients in the circle of care, leaving them feeling confident, most importantly, hopeful, and supported amongst this terrible diagnosis. So Our big question now was, okay, if 80% of the people we see out of that 30 that we tested want to know what to expect in the future, and 60% want to deal with their feelings and worries, are we supporting them with this on a regular basis? Now, we knew that not every diagnosis of dementia was referred to social work. I showed you that crazy chart of how busy our clinics are. There's too many for us to handle them all. We also knew that sometimes people got a diagnosis, lost their driver's license, and left our clinic feeling lost. And that's not to any detriment of our team. It just happens. Hence our idea for pilot number 2. Next slide, please. So we've now expanded our caregiver-centered care approach to include all our staff, not just social work. And we've started a second pilot for 30 cases and are currently in the middle of the process. It's now a collaboration with our RNs and our social work team, offering follow-up clinics after the geriatricians have done their assessment and provided a new dementia diagnosis. Patients and any of their support people, all their caregivers, are invited to attend this follow-up clinic, where we divide the patient and their caregivers to offer individualized and tailored support using the Caregiver Needs Assessment tool as our starting point. We've had patients bring their children, their community social workers, friends, spouses. The patients have had an opportunity to discuss their worries and concerns outside of their family and complete their personal directives. And the family, caregivers, friends, also get their questions answered and support provided, tailored to the needs, so that we can link them to the community resources that are there that are specific to them. No more referring to everywhere, which tended to be overwhelming. The results is, this is selfish, but we're all happier. Everybody who's involved in the program, even our admin who assist, asked us to share the results at a team meeting. We have families and patients putting notes into a basket to give us feedback. Like I said, we're pretty rudimentary researchers. We said, hey, can you just write a little note about what you thought about this? And what they're saying is, what would have happened if this wasn't offered? Thanks for providing the road forward. This is a perfect example of family-centered care. Now, that person happened to be a caregiver and a healthcare provider. They knew the lingo. One of our geriatricians has asked us to start this in rural clinics, and we're getting more creative day by day. The evolution of how we see caregivers is growing. We're trying to set up some volunteers to sit with some of our patients with dementia so we can provide caregiver support without the caregivers using their respite hours. I believe we're all shifting culture. We're also excited to tell you, very excited, that we've committed, our management is committed and taken out a grant that we're going to train all of our massive seniors palliative continuing care portfolio in caregiver-centered care education. That's over 2,200 healthcare staff. We're excited to see the new pilots, the approaches to caregivers that will come from the champions as they get identified. Our dream is that we don't get any more calls from desperate caregivers in elevators anymore, that all staff see, recognize, and support caregivers and their families when they need it. It's not complicated. It makes a difference in healthcare for our patients, their families, and caregivers, and for us as frontline staff. So now you get to learn more about this training from Dr. Parmar. It's really worth investing.
Thank you, Alison. First of all, congratulations, on you are seeing successes of your hard work, your commitment, your passion, and you've become a role model for the rest of our province. We have many such stories now coming from various sites and services that have taken on caregiver-centered care. Thank you for leading the way. Next slide. So we are delighted to tell you that this caregiver-centered care initiative is gradually being rolled out across our province. And currently we have 13 organizations and close to 40 continuing care sites, which includes long-term care, congregate facilities, we call them designated supportive living, assisted living, etc., home and community care. 40 such sites that are rolling out the caregiver-centered care. This is just a snapshot. We curated the evidence for these sites, showing them the benefits of involving family caregivers in these continuing care sites. And we have such evidence for engaging caregivers everywhere, whether it's acute care, emergency room, rehabilitative care, end-of-life care, home care. So please reach out to me if you need any of this evidence, because it really does help to make a case for caregiver-centered care with your decision makers, with funders, and in creating policies. So absolutely, it helps enhance population health. We are talking about aging at home. So this is a major population health intervention. You support family caregivers, you're going to support aging in place, aging in the community. It reduces all kinds of issues that are emerging in our society. Engaging family caregivers in our work reduces loneliness and social isolation for our care recipients, which is an emerging health almost crisis at this time. It reduces healthcare costs. So for funders, prevents avoidable hospitalization, medication overuse, all kinds of cost effectiveness has been shown if you engage family caregivers in supporting people with dementia and behavioral problems, enhances experiences of care. And you can hear it in Alison's voice. You know, it enhances absolutely the experience of the resident, call them resident patients or clients, and family caregivers, but it improves our work satisfaction, gives us more joy at work, improves our own sense of well-being, and actually reduces our workload if we are proactive in engaging and supporting family caregivers, and it contributes to health equity. Next slide. The work we are doing, and which we would encourage you as well, if you want to build on build towards a caregiver-centered care culture, is a system change. Now, our mantra is to build a better system of support for family caregivers in which they thrive, instead of focusing on building a better caregiver, which means we have to have we have to believe in family caregivers being literally being partners in care. They are they are part of our team. This is a transformative change. To actually bring about that culture change, our mental models have to change. And when we see family caregivers, we should acknowledge them, value them, respect them, not just shift care onto them. Relationship change. So we've got to get away from this power dynamic we have in the healthcare system. There's hierarchy in the system. We got to flatten it. They've got to be seen as equal partners in providing input, insights, planning care, and even supporting care. And yes, we need policies, practices, and resource flows, which is the structural change, which we are starting to move towards. We have family caregivers now in our Continuing Care Act. It expects home care providers to identify family caregivers, assess their needs, and support them, and so on. Next slide. So we speak of a collective impact approach. So as you are reflecting on this presentation, think of the system that needs to come together to make this happen. Currently, we have an Alberta Health Grant, which is about innovating integrated supports. So while we were doing this work in healthcare to bring about this transformative change in healthcare, community sector was also trying to rise to this challenge of supporting family caregivers. Researchers have been doing research for 30 years. We are starting to pay attention to their evidence. Educators are starting to look like how can they train different disciplines so that when they go into settings and services, they are well equipped to have the right knowledge, skills, approaches to engage family caregivers. And yes, age-friendly. We are talking about aging in place, and we remind all age-friendly initiatives. We remind them, we go to them, the various senior, Glenda knows this term better, serving sector agencies and organizations. We go to them and say, you know, in your mandate, in your objectives, in your strategic planning, where are family caregivers? So how are you creating age-friendly communities and you have not engaged or acknowledged the role family caregivers play in it? So you see that change occurring. And then, of course, policymakers, and I'm going to ask you, go back to your organization. Is there a policy that talks about family caregivers, or is it just patient and family-centered care? Because that usually means more work for families. So with this new grant, we are bringing all these people together and we are creating a strategy map for Alberta. Each and every area that's on this slide is being represented. We are having round tables with them. We've done a discovery phase. We've come up with primary and supporting strategies, and I'm happy to share all that with you. And now we are talking about engagement into action and implementation. So we have become quite ambitious in our work. Next slide. And it has been a long journey. And what we're going to share with you is for you to take and use. So we've done the relational change. It took us quite a few years to bring about this awareness of who family caregivers, what are they doing, what are their contributions, their challenges, and how we need to, within the healthcare system, also play a part in partnering with them. And then we went about, of course, okay, if we are going to have healthcare providers do this, what knowledge, skills, and approaches do they need? And we have built different levels of education with a massive co-design team. And they have helped us produce all this education. It's been validated. It's for you to use. And this team now has gone into co-production of the strategy. So all this education is for free. It's out, and I'll show you where you can access it. And this is the education Alison was referring to. Many of our healthcare settings are now for the caregiver-centered care practice, taking this education and using it for their staff and help building practice around caregiver-centered care. Next slide. And of course, what we are doing with the educators, with staff orientation, with clinical practice leads, with similar interventions being done, similar sort of actions being assimilated in the community. They're doing the same thing with their care providers, because healthcare providers don't just work in healthcare system, they work in the community as well. And then there are numerous social care providers, and they could be link workers and staff of various community organizations and associations. So we are asking them to examine their education of their staff to close this gap in what family caregivers need and expect from us, and what are we trained to do. So you can see why our staff would not have the confidence if we have never ever in their training or in their orientation or given them opportunities in continued professional development to learn about caregiver-centered care. Next slide. And for this, we have validated the caregiver-centered care competency framework. It'll resonate with you. We created the term caregiver-centered care, which is basically person-centered care for family caregivers. And we defined this as an approach that respects and meaningfully involves the person's family caregiver in planning and delivering of supporting services. It also recognizes and addresses their needs and preferences and integrates them as partners of care. It includes recognizing them, communicating with them in a timely, responsive manner, partnering with them, including shared decision-making. Fostering resilience in them is about assessing their needs, like Alison said, with tools like Jasneet, then helping them it's everybody's responsibility to help family caregivers navigate the system. And we can all play a role, because if we know what the caregivers need, we also know what we can offer, but we also need to know what others can offer. And making those referrals is important for them. And of course, enhancing the culture and context of care. Till we don't change that, the rest is not going to flow. Next slide. So here they are, the different levels of education. We did also create a COVID module. It's still it's still around, and we still need our staff need support in interacting with family caregivers when our facility, etc., are temporarily closed for free interactions. But we have the foundational education, and I misspoke. Earlier, I was thinking of a zone when I gave you stats on healthcare providers versus family caregivers. In Alberta, we have 140,000 healthcare providers and over 1 million caregivers. Our goal is to have all healthcare providers, all 140,000 of them, receive the foundational caregiver-centered care education. The advanced level, which is 6 hours, foundational is 1 hour. The advanced level is for those disciplines, those providers who spend a lot of time with family caregivers. It's within the scopes of practice. And we have many disciplines now making it a competency, a core competency: social workers, rec therapists, occupational therapists, different positions like geriatric assessment nurses, psych nurses, palliative care nurses, etc. Different positions like case managers, system. I'm just throwing out disciplines, positions, titles that actually spend. It is part of their work to interact with family caregivers. And we already do this. We just need to do it well. And the champions level is for people like Alison. These are our champions who take this caregiver-centered care concept and help settings and services think about it. And not just that, show them the way, how it can be done. Next slide. It's on this website. Please make a note of this website. Please write to us if you want support in implementing any of these levels of education. And we do much more than help support the education. We also support the promotion of practice, assimilation into practice. So our work with these 13 organizations is a 2-year project. And we also help them evaluate the education as well as the practice to see what it took for that site to implement the education. Did it make a difference for healthcare providers and then for family caregivers? Next slide. Over to you, Glenda.
Thanks, Dr. Parmar and Alison, for sharing a wealth of information for us today. Now we want to give you, the audience, an opportunity to participate through some reflective questions we have for you. And Kayla's just pulling up on the screen the opportunity to engage and provide your responses to these questions through the use of Mentimeter. So we'll give you a moment here just to get your devices out and scan that QR code. And I'll turn it over to Kayla if there's any additional information you have to use the use code, right? And then we'll dive into the questions that we have for you today. Okay, how about we begin? I think everybody's probably just frantically scanning the code and logging in, but great, I see a first response. Thank you to whomever that is. So where do you see yourself in the system of change in terms of caregiver-centered care, all that you've heard this morning? Reflecting on your personal and professional lives, where do you see you might engage with a caregiver-centered care approach? Some people saying at the beginning, some are clinicians, researchers, promoting it to agencies that you work with. There's some other thoughts here coming in, and I invite Dr. Parmar or Alison to jump in here as well if you can see the responses coming up on the screen. Maybe we'll just get Kayla to scroll a bit on the Mentimeter so we can read some of the lower responses if you're able to. Great, promoting the idea. Love it. These are all integral pieces to scale and spread of a quality assurance initiative like caregiver-centered care. It starts with us. Do one thing today to make a difference for a family caregiver. That may be recognizing them when you interact with them in care, or sitting down as a clinician or registered nurse, multidisciplinary healthcare provider, and really actively listening to where they're at and what supports they might need. so that not only do they feel heard, but you have the opportunity then to step in and be proactive in supporting a family caregiver versus the system having to be reactive when a family caregiver presents in emergency and they've been spread too thin and are in a burnout phase. I love these responses. Improving quality of care, absolutely. Weaving a caregiver-centered care approach into all practices, love it. Advocate, educator, and supporting my colleagues. We've got some great responses here. Let's move along to question number 2 now. And question 2 is, what are some tangible actions you could take to support family caregivers based on where you see yourself in the system of change? So similar to question 1, now we want to get down to some things that you could start doing today, tomorrow, after this webinar to support family caregivers. Education and policy, those are big pieces, right? Taking the time to educate staff, having the commitment from leadership to provide staff with education to enhance their competencies, to better step in and support family caregivers. It's proactive is critically important. Advocacy and research, again, coming to the top here. And elevating the importance of family caregivers within the system of care. Love that answer. That's really what we're here about today, is recognizing the contributions that family caregivers are providing to the system of care. It's interesting if we were to think, and we've seen the numbers, the stats, if family caregivers decided tomorrow to go on strike, I'll give you a moment to think about the impact on the system. Our system is already stretched beyond its limits. And if family caregivers decided not to show up for the work that they're providing today, tomorrow, our system would collapse without question.
And if I may
And
add,
yeah, go ahead.
I was just quickly going to add, we are asking family caregivers to do more and more. Think about all these medical and nursing interventions, running crisis, catheters, bags, acquiring respiratory equipment, managing oxygen. I mean, the list is so long. We got to stop and ask ourselves, if we are asking them to do more, how are we supporting them? What are we doing to support them? Always when you ask family caregiver to do anything, just stop and say, okay, I'm asking them to do this. How am I supporting that person?
Thanks. And the last question is, before we close, I see we're getting down to our final minutes here. So we'll just quickly capture your responses on what are some successful examples of things that you've seen or done to engage and support family caregivers. Maybe you can begin putting those responses in to the Mentimeter as we close off our session for today. Kayla, if you want, can you move back to the slides and keep the Mentimeter open? Is that possible?
Yes, for sure. We'll keep the Mentimeter open and we'll bring the slides back up.
Yeah, and thank you all for your responses. We will capture these and have a look at them. It's informative for us as well. So this is a learning opportunity for our team also. So as we circle back, we've shared a lot with you today about the contributions and challenges of family caregiving and why it's so critical to health and community care and quality and family caregiver well-being, that family caregivers are supported and included as allies and partners in care. We've also shared about initiatives that are happening here in Alberta Health Services that are taking a different approach to supporting family caregivers, and we hope that that has inspired you to be a change maker within your own circle of influence. As Alison mentioned earlier, at some point, all of us are going to be a caregiver or a care receiver. We have the opportunity today to work together to change the culture of care for a more inclusive and collaborative health and community care system for the future that will better support the aim of aging in place with the needed supports being met. So we throw to you a challenge to join us, collaborate with us in this call to action to lead the way to a brighter future where family caregivers are recognized and supported as partners in care. A future where all health, social, and community care providers are educated on and practice caregiver-centered care by recognizing and partnering with family caregivers as part of the care team. Thank you so much for your time and attention today. We welcome your questions. Andrea, thank you to you and the Healthcare Excellence team for inviting us to be here. We've given you our contact information on the slide as we wrap up. So over to you, Andrea, and thank you so much.
Thank you very much. Thank you, Glenda. Thank you, Dr. Parmar. Thank you, Alison. I can tell from the engagement in the Mentimeter that, you know, folks really appreciated the opportunity to not just be reoriented to what a family caregiver is, but, you know, to be inspired by your call to action that's now supported by really tangible resources that folks could go to. So we will send out links to everything that was talked about today in our follow-up email with also the link to this recording. And just also wanting to share that there are a couple of other exciting opportunities to engage coming up. The National Caregiving Strategy for Canada through the Canadian Centre for Caregiving Excellence is happening in February. And our next Aging in Place workshop will be extended to an hour and a half. It will be a virtual storytelling workshop. We know how important it is for sustainability that folks really find new ways to articulate the stories and the impact of the work. And we're excited to help you do that through that session. So we thank you in advance for already starting to answer the poll questions. Once again, thank you so much to our guests for your presentation and your inspiration today. We loved having you. And until next time, I hope you all stay well and stay connected. Take care.